Patients often ask me what's the recovery like after a tummy tuck. Immediately after a tummy tuck, there are a couple of things that I make sure my patients understand. The first thing is that they typically will have a drain. The drain can be in place for about 5 to 7 days. We take that out typically at their 1-week visit. This helps remove the extra fluid. In addition, I use a pain pump. The pain pump is placed in the area where I put the muscles together to help with the pain. That area causes the most significant amount of pain, and often the pain pump really helps with this. The pain pump is actually removed by the patients at approximately 3 days after surgery, and they just pull it out. There's no stitches. There's only a sticky tape that holds it in. The pain pump really helps with their recovery, and my patients have been very happy with that. The next thing is that the patients have to be maintained in a compression garment, which is usually an abdominal binder. The binder has to be maintained fairly religiously almost all the time throughout the day, 4 to 6 weeks, and sometimes longer. This is very important because it helps the tissues that have been lifted off heal back down. The next thing is exercising. I don't want my patients performing significant exercise such as weightlifting, running, aerobic activities, or sit-ups for about 4 to 6 weeks. What I do want my patients to do is immediately after surgery, usually within 2 to 3 hours, they need to be up and walking. This is extremely important because I want to avoid any risks of blood clots, also called DVT and PE. This is very, very important. I often remind my patients to kind of work their calves to go back and forth like they're pushing on the gas pedals to make sure their pumps in their legs are pumping the blood back to their hearts to help avoid blood clots. After that, patients actually, when their first 1 to 2 weeks, have to walk over a little flexed because we literally pull the tissues down so tight that they can't straighten up completely. And this usually improves within 1 to 2 weeks. After about a month to 6 weeks, I start having my patients resume normal activities. And they do this gradually. It's not uncommon for patients to have a little bit of weight gain during that time, and that's a transient weight gain. That typically gets better just with time, with good diet, and aggressive exercise. Thank you very much.